Hi everyone, in this video, I, Nurul Farah Ain and my friend Siti Nurhidayah will present about the human brucellosis outbreak caused by unpasteurized goat meat in Klang district in 2018. First of all, human brucellosis is a rare zoonotic disease in Malaysia and it is caused by a bacterial genus Brucella. The transmission is via contaminated food, infected animal, and open wound. Now let's move on to the case description. The cause of the outbreak is unpasteurized goat meat and the location is in Klang district. It reported 2 outbreaks of 8 human brucella cases which occurred from October 2018 till February 2019. A total of 5 confirmed and 3 probable brucella cases were reported. Out of these, 4 patients had brucellosis after consuming unpasteurized goat meat from a single goat farm, while the other 4 are farm workers from a cattle farm. Among 8 cases, 2 were children aged 6 and 10 years old. All 8 cases presented with fatigue, anorexia, and prolonged fever. 4 of them presented with headache, myalgia, and weight loss, while 3 had arthralgia and 1 experienced night sweats. All the patients required an average of 14 days of hospitalization and received at least 6 weeks of combination antibiotic, and all 8 recovered without long-term sequelae.
If we are suspected to have the symptoms of brucellosis, the diagnosis must be done by a doctor in order to confirm the brucellosis infection before getting a treatment. Several tests can be performed to look for bacteria in samples of blood, bone marrow, or other body fluids. In addition, a blood test can be performed to detect antibodies against the bacteria. Once a diagnosis is made, then the prevention method can be applied. According to Zinstag et al. In 2007, brucellosis must be controlled in animals first before it can be controlled in humans. Several methods are introduced and they are broadly divided into primary and secondary methods. For primary methods, there are 3 steps recommended which are selection of a disease-free stock, culling, and prevention of exposure to other herds or wildlife. These 3 steps are made to minimize the probability of brucella contamination and preventing brucellosis. If the primary methods are happen to face a failure, then the secondary methods are taken in which a doctor can prescribe antibiotics after a patient is diagnosed with a brucellosis infection. The antibiotics are given according to the patient categories where the non-pregnant patients are given doxycycline with a combination of gentamicin or ceftriaxone, while for pregnant patients are often given with rifampin antibiotics alone or sometimes with a combination of ceftriaxone. That's all from us. Thank you for listening.